Okay, so today we're going to take a really clear, balanced look at the side effects of some of the most talked about drugs on the entire planet. I'm talking about GLP-1s like Ozempic, Wegovy, and Mounjaro. So what's the real story behind all the headlines? Let's get into it.
I mean, you've seen it. These medications have absolutely transformed how we treat obesity and diabetes. The results can sometimes rival what we see with surgery. But now that millions of people are using them, it is so crucial to understand the full picture. So yeah, what are the trade-offs? What's the catch?
All right, here's what we're going to cover. We'll kick things off with the basics, how these drugs actually work. Then, we'll dive into those common side effects you've probably heard about. After that, we'll take a responsible look at the more serious risks. We're also going to unpack that whole debate on muscle loss, give you some practical ways to manage everything, and then, finally, kind of step back and weigh the benefits against the risks.
Okay, first things first. To really get a handle on the side effects, you have to understand the science. How do these drugs actually do what they do inside your body?
So the key is this term, GLP-1 receptor agonist. It sounds complicated, but it's not. Your body already makes a hormone called GLP-1 whenever you eat. These drugs are basically just engineered, long-lasting versions of that exact same hormone. They plug into the same spots and just turn the volume way up on the signal.
So what does that signal actually do? Well, it's like a multi-pronged attack on hunger and high blood sugar. First, it slows down how quickly your stomach empties, which is a huge reason why you feel full for so much longer. It also sends signals straight to your brain to dial down your appetite. And this is critical for diabetes. It helps regulate your blood sugar by boosting insulin and telling another hormone, glucagon, to take a break. Now, you're going to want to keep these things in mind because they are the key to understanding all the side effects.
Okay, so let's see how those mechanisms translate into the most common issues people run into, which are almost all centered around the digestive system.
And these issues are, well, they're really common. We're talking about a majority of patients, somewhere around 50 to 60%, who will experience some kind of gastrointestinal symptom. Now, the good news is that for most people, these are temporary. They tend to fade away as your body adjusts, especially if the dose is increased nice and slow.
And here they are, the usual suspects. Nausea is by far the #1 complaint. That's often followed by things like vomiting, diarrhea, and constipation. That feeling of a really decreased appetite, well, that's part of the intended effect, of course, but for some people, it can definitely feel like a side effect.
So why does all this happen? Well, it goes right back to how the drug works. By slowing down how fast your stomach empties, food just literally sits in there for longer. Now that sends fullness signals, which is good, but it can also trigger nausea. Honestly, that kitchen sink analogy is perfect. If the drain is slow, things are going to back up.
Okay, moving beyond the common GI stuff, there are some less frequent but more serious risks that really need a responsible, evidence-based look.
So several large studies have found a link between these drugs and gallbladder problems, like gallstones. But here's the crucial point. This seems to be driven more by the rapid weight loss itself, not necessarily a direct effect of the drug. I mean, losing a lot of weight quickly, by any method, is a known risk factor for gallstone.
Pancreatitis, which is an inflammation of the pancreas, is another concern. And while some early reports flagged a potential link, those huge, long-term heart-related studies on these drugs haven't shown a clear increase in pancreatitis compared to a placebo. It's still a point of caution, though, and the drugs are usually avoided in people who've had it before.
This next one really highlights why your personal medical history is so important. These drugs have what's called a boxed warning. That's the most serious kind, about a very rare type of thyroid cancer. Now, this is based on studies in rodents, and because of that risk, these drugs absolutely should not be used by anyone with a personal or family history of this specific cancer.
So while slowing down the stomach is an intended effect, in rare cases it can become extreme. This condition is called gastroparesis, and this severe slowing can lead to bigger risks, like intestinal blockages. It's also a major reason why anesthesiologists now recommend that patients hold off on these medications before surgery to reduce the risk of aspiration.
All right, let's tackle one of the hottest topics around these drugs, muscle loss. It's a really nuanced conversation, so let's break it down.
So the central concern, and you've probably seen this in the headlines, is that some studies suggest up to 40% of the total weight loss can come from lean body mass. And since muscle is a huge part of lean mass, this raises some really valid concerns about strength, metabolism, and frailty, especially for older adults.
But this is where it gets more complicated.
Newer research is making a distinction between the quantity of muscle and the quality of muscle. So while yes, some absolute muscle mass is lost, which happens with pretty much any significant weight loss, the quality of the muscle that's left might actually get better. As you lose fat, there's less fat mixed in with the muscle, and insulin sensitivity improves, which can actually lead to better overall physical function. It's a fascinating trade-off.
Okay, so with all of this in mind, what can actually be done to manage these side effects? Because the goal is always to maximize the benefits while minimizing the risks.
The good news here is that a lot of these side effects can be handled with some pretty practical behavioral strategies. That start low, go slow approach to dosing is absolutely critical for the GI issues. And simple changes like eating smaller meals, avoiding greasy food that's slow to digest anyway, and just staying hydrated can make a massive difference.
And it's so important to remember, these drugs are not for everyone. This right here summarizes the key groups who need to be extra cautious or maybe avoid these medications entirely. This includes people with a history of pancreatitis or those specific thyroid cancers, and also people with pre-existing severe GI problems. And for older adults, the risk of speeding up age-related muscle loss has to be weighed very carefully.
So let's just step back for a second and look at the big picture. Because like any powerful medication, using GLP-1 drugs is all about balancing the proven benefits against the potential risks.
And this really puts that balance into perspective, doesn't it? On one side, you have these profound benefits. We're talking significant weight loss, much better blood sugar control, and proven protection for your heart. On the other side, you've got the risks we've just discussed, ranging from the super common GI issues to those rare but more serious concerns.
So here's the bottom line. There is no one-size-fits-all answer. Not at all. The right choice is deeply personal. It depends entirely on your individual health history, what your goals are, and what level of risk you and your doctor are comfortable with. And that really leads to our final and honestly most important takeaway. While knowing all this information is empowering, the only way to make a truly informed decision is to partner up with your healthcare provider. They're the ones who can help you navigate this whole complex landscape and find the safest and most effective path forward for you.